And on our second and last part of my COVID-19 fight series, the war against the coronavirus pandemic is being fought in hospitals around the world. Doctors and nurses and other medical practitioners are grappling with huge workloads in addition to increased risk of infection. Hospitals lack sufficient ventilators for patients and personal protective equipment for health workers. How can health workers leading the fight against COVID-19 be better protected and motivated? We try to answer this question. Doctors and nurses around the world are putting their lives on the line as they try their best to manage the growing number of COVID-19 patients. Can the enormous physical and mental strain on them be reduced? Pumwani Maternity Hospital in Nairobi. No visitor is allowed here. The obstetric and referral hospital is temporarily out of bounds for new patients. The Ministry of Health says this is to allow the government time to put in place measures to curb further spread of coronavirus. At least 41 employees at the country's largest maternity hospital have tested positive for COVID-19 in the month of July alone.
21 or 22 are support staff, ancillary staff from revenue, kitchen, CSSD and the like.
The Kenya Medical Practitioners, Pharmacists and Dentist Union says so far over 500 healthcare workers have tested positive for the deadly virus. At least 3 have succumbed.
Any patient who walks into the facility could be COVID positive, asymptomatic and presenting with other symptoms or other illnesses, but also having COVID. And that when that happens, by the time the suspicion of a patient having COVID and they're tested positive and they have interacted with the number of healthcare workers, then we've exposed as many healthcare workers as possible.
For every life saved from COVID-19, numerous others have been put at risk in the form of duty and self-sacrifice. Asha Hassan, a nurse at Pumwani Maternity Hospital, knows better than most the price of caring for highly infectious patients. The mother of 3 contracted COVID-19 in the line of duty.
I was off duty. The in charge or the nurse in charge of the facility called me and she told me over the phone that you turned positive. Karibu ni faint cause nilikuwa kwa njia. I was in Kangundo na kuja hivi Nairobi. Hata nilishindwa kudrive. Nikaenda kwa petrol station nikakaa for like 1 hour. Ndo hazi yangu akanikujia akachukua gari akanileta nyumbani. I don't know if my kids are in window period wataturn positive. Yani nilikuwa na mawazo mengi.
She was the first nurse to test positive at the facility.
Even before I was tested, I was having all the symptoms like body weakness, headache. Even if I swallow painkillers, it was not going. Nilikuwa nayo. Sore throat, asthmatic attacks, frequent attacks than the normal one. Nilikujia na ambulance, black ambulance. In fact, hata majirani walijua niko na corona hiyo time.
Being asthmatic, she feared for her life.
Sometimes nilifeel kama naweza enda into ICU or HDU because I was worse. The 5th day after testing positive, nilikuwa worse. That pain was too much. Even if I was nebulized or given any medications, haikuwa inaenda asthmatic. Nilikuwa tu chest bado inashikana.
For 11 days, she battled the disease.
But the medications like antibiotics, nilijibaia mwenyewe, food, everything, nilikuwa najifanyia. Even the counseling, consultation, nilijilipia.
Her 1-year-old baby who was breastfeeding also tested positive.
I went there for 2 days in isolation, Kenyatta. The small one has started showing all the symptoms. Alikuwa na homa, headache, na fevers ambaye haiendi hata umpe hata antipyretics, hizo madawa za kumaliza fever.
Asha has recovered, but she is scared of reinfection.
At least alhamdulillah I'm okay. Right now na feel poa, lakini sijui vile nikirudi job if I will get reinfected again ama nita remain negative. So right now hata nikikupigia calculation nimespend like 73k.
Accessing proper personal protective gear is still a challenge.
Now hata neighbors wanani stigmatize, nikitoka nje hata kuanika nguo mtu anakutoroka, so unaamka saa 9 usiku uanike nguo.
Some of the healthcare workers basically just staying at home, being asymptomatic and all, but just staying at home without a clear pathway of treatment and care.
Kitu tu ningetaka tupewe the right PPEs na waandike more nurses at least, because una hustle mpaka unajipata umekuwa infected.
With the coronavirus overwhelming the country, medical staff are faced with an additional trauma of having to work without the proper protective equipment, and soon may have to choose who is and who does. Purity Museo, Channel 1 News, Nairobi.